Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's session is part of our Nutrition During Cancer Treatment Education series, a special collaboration between the Blum Center and Mass General Brigham Cancer Institute. Before we get started, I want to give a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has music and hear our guest speakers today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you if it was complete. Your feedback is important to us as we plan future programs. All right, so next, I'm going to turn it over to Rob Dunn, who will get us all started.
Awesome. Thank you so much, Amy, and thank you to everybody who took some time out of their afternoon to spend with us. I am super excited to continue this series through the Blum Center, and Martha and I have been super grateful for the support that they've offered. I am the clinical nutrition manager within the Mass General Brigham Cancer Institute, and today we're going to be led through this discussion by Martha, who's a dietitian on our service. The session today covers managing taste changes through cancer treatment and is part of a series of navigating symptoms that are barriers to adequate nutrition in context of cancer treatment. I will be monitoring the chat and will help kind of navigate through the questions at the end, and I will pass it to Martha now.
Awesome. Thank you, Rob. I'll share my slides. All right. Is that showing up for you, Rob and Amy?
Yes.
Awesome. I know there was a little lag on my end. As Rob and Amy shared, today we're going to discuss managing taste changes during cancer treatment. Here's a quick look at our agenda. I'll start by giving a brief overview of nutrition and cancer care, and then we'll discuss taste changes, including the physiology and perception of taste, some dietary approaches to management, other interventions that may be helpful during treatment, and then we'll wrap up with some practical tips and tricks for a typical day. Nutrition and cancer care. Our team of registered dietitians works with patients, their families, and their oncologists to manage the side effects of treatment, including taste changes, develop individualized diet and hydration plans based on patient preferences and dietary restrictions, recommend oral nutrition supplements, prevent, identify, and treat malnutrition, guide tube feeding support as needed, and finally, counsel on nutrition for wellness and survivorship, in part through the hospital's lifestyle medicine program. Before we discuss how taste changes during cancer treatment, it's important to understand how taste works. Taste buds are located in the small wart-like bumps that are visible on the tongue's surface, and these are known as papillae. They each contain anywhere from 10 to 50 sensory cells that sense and send taste signals to the brain. Adults have anywhere from 2,000 to 4,000 taste buds on the tongue and in other key spots inside the oral cavity, and the body replaces these cells on a weekly basis. So we would consider these cells to have a relatively quick turnover rate. Some sensory cells react to all tastes, and others are specialized and react to a single taste only. The job of these specialized cells is to transmit information about the intensity of taste. So, for example, how salty or sweet something is. Contrary to popular belief, the tongue doesn't have specific zones for each taste and can actually perceive all tastes, but it does so at varying sensitivity levels. So those more generalist sensory cells and specialized cells are both scattered everywhere, but the back of the tongue has a higher concentration of the specialized cells that really are attuned to more bitter tastes, and there are some areas that are more attuned to sour, sweet, salt, and umami tastes. But again, it is possible to identify all of these 5 basic tastes across the tongue. And generally speaking, most meals will include a combination of the 5 basic tastes. So, sugars, glycols, alcohols, and aldehydes found in different foods cause those sweet taste buds to pop. Hydrogen ions in more acidic foods, things like citrus, tomato, lead to a sour taste. Salt ions or sodium chloride in certain items cause that salty sensation. And then a variety of different proteins, primarily from plant sources, lead to a bitter taste. Interestingly, there does seem to be a genetic basis for how well people can taste bitter, and this may be protective as certain plants that are toxic for humans tend to be more bitter. And so being able to taste that would allow people to kind of spit those foods out. And then finally, glutamic and aspartic acid are two of the compounds that lead to that umami, more savory taste. Additionally, smell, texture, and temperature impact taste perception, and that's important to keep in mind when we start to think about other ways we might be able to work around some of the challenges that patients experience during treatment, impacting taste that might stem from the tongue. There are a variety of different reasons that taste might change during treatment, and taste can change in very different ways. A few key terms are in this box on the right. Agousia is the absence of taste, and so this might be described by people as food that is completely bland and flavorless. These folks really can't taste anything at all. Hypogeusia is a reduction in taste, so that might present as more muted flavors. Dysgeusia is distorted taste, and so this may present as the presence of a bitter or metallic flavor. Um, a variety of different changes could fall under this umbrella. And then finally, hypergeusia is an increased taste. So one example of this could be a heightened sensitivity to sweet flavors, for example. One of the primary reasons that we believe taste changes is due to direct damage that the taste buds receive from chemotherapy, radiation, and even immunotherapy. Another proposed mechanism is impaired taste bud cell turnover. And so, if you recall, because our taste buds are replaced on a roughly weekly basis, that rate of turnover may be damaged by some cancer treatments that target other rapidly dividing cells. Dry mouth, due to a reduction in saliva production or other reasons, inadequate hydration could be a factor, can impact taste. Mucositis can alter taste. It can essentially cause pain sensation on the tongue that may interfere. And infections and some treatments for infections, for example, nystatin, a common treatment for thrush, can shift taste. Finally, anosmia or loss of smell impacts taste as well, and that's because smell is an important part of taste perception. Up to 85% of patients receiving cancer therapy do report taste changes, which is quite a high prevalence. And I do want to note that because taste helps us identify and stop intake of toxic or spoiled substances, there is a very good physiological reason to reject food that tastes unusual or bad. So, although family members, friends, and the care team, including dietitians, will encourage our patients to figure out how to work around and push through the taste changes they experience, it can be incredibly difficult to do so. That said, there are a few approaches we will recommend that might make it a little bit easier to identify things that are tolerable. For people who are experiencing bland and flavorless tastes, the first thing we usually assess is whether or not any flavors might pop. So, for example, if someone can taste sweet, we would want them to really capitalize on that by using naturally sweeter sauces, marinades, even broths to help draw out flavor. The FAST acronym, which stands for fat, acid, salty, and sweet, can be quite helpful too in order to identify certain things that might pop on the palate. So, fat sources like olive oil and avocado help distribute flavor evenly across the palate. Acid, like citrus, can brighten flavors and just make them a little bit easier to identify. Naturally salty foods like Parmesan and soy sauce draw out flavor, and sweet items can help to balance bitter, sour, and even spicy tastes. Lastly, I do want to note that spicy is not actually a flavor, it's a temperature sensation that activates pain and heat receptors on the tongue. So, adding a lot of spice to food may not help when it's tasting bland or flavorless. If food tastes very salty, leaning into naturally sweet things like fruit can help counter that salt flavor. That might involve adding jam, jelly, honey, maple syrup to meals that, those items would appeal to include during. Those might not work as well with a more savory dish. For protein sources, adding a little lemon juice can help cut the salt taste. And finally, purchasing low sodium products is going to help reduce how much sodium chloride, those salt ions, get into the taste receptors. So that can help as well. If food is bitter or metallic, avoiding silverware and metal cookware can help because those items can actually increase that metal taste through contact with food. So, eating with bamboo utensils or chopsticks might be an option. Avoiding aluminum foil to store food and canned goods can help cut down on that contact with metal as well. So, that might look like using either fresh or frozen fruit and vegetables. Choosing tolerable protein sources is important as well. For some people, red meat in particular tastes very metallic, and so poultry, fish, or plant-based proteins might be a better option. That's a bit individual though, so not necessary if red meat tastes okay. Um, Seasoning food with onion, garlic, or chili powder can help cut down on those bitter metallic tastes. And finally, if water is metallic, adding a splash of a favorite juice, a wedge of lemon or lime, or even other sliced fruit can help to curb that intense metal taste. Some people will also experience improvement depending on the temperature of water, anecdotally. So, playing around with cold room temperature or even warmer water could be worthwhile. In terms of other interventions, using a baking soda or salt rinse as a palate cleanser can be quite helpful, particularly if someone is experiencing off or really unpleasant tastes with eating. Usually, adding around a quarter teaspoon of baking soda and an eighth teaspoon of salt to a cup of warm water and mixing it up will make a batch that lasts the whole day, although this ratio doesn't need to be perfect. And if things do taste really salty, omitting the salt and just doing baking soda in warm water will work as a palate cleanser as well. You'd want to stir, swish, and spit, and potentially even do a plain water rinse before eating. There is some evidence that herbal tea, specifically Gymnema sylvestre, consumed before meals may help reduce overly sweet tastes. Although I want to note it's always important to check any herbal teas with the pharmacy prior to consumption to make sure they're safe to drink during treatment. And then lastly, miracle berries. These are a very interesting tropical berry that you can purchase online. I believe some pharmacies and grocery stores may even carry them now as well. Essentially, it's a dried berry that enhances the perception of sweet flavors. I've actually tried them and they're very bizarre. I had one and then tried a little cup of lime juice and it tasted extremely sweet, almost like a lime soda with lots of sugar. So I think for these, if someone wanted to use them, they would probably work best if a person was experiencing very bland flavors and then um, ate something that they would expect to taste very sweet. Otherwise, with something savory, at least in my experience, they might not work as well. Another intervention that we've been recommending to patients in the Cancer Center recently came from a very recent study done this year in patients receiving tarlatamab for previously treated small cell lung cancer. And in this patient population, about a third of people reported dysgeusia, so that distorted taste. Investigators used a variety of previously published strategies for management, including nutritional counseling with a dietitian, maintenance of good oral hygiene, and adequate hydration. But interestingly, they also used periodic chewing of cardamom pods, and then they had patients inhale the scent of either clove or lemon at least twice daily for 15 seconds. And this did seem to improve the patient's perception of taste. So, particularly with a lemon, very low cost item that most people have on the counter or in the fridge, I have been telling patients to just try slicing it before a meal, closing their eyes and smelling it for 15 seconds because if it works, great, low cost, no risk of harm. If it doesn't, move on, but could be a good, easy option to try. And then I also wanted to address zinc because this um, supplement is one we do get asked about from time to time. Zinc is essential for taste bud function, and there is evidence that high dose zinc supplementation improves taste in patients who have a zinc deficiency, idiopathic taste disorder, which is loss of taste due to an unknown cause, and taste disorder related to chronic renal failure. However, zinc supplementation is not proven to prevent or improve loss of taste related to chemotherapy specifically. And for patients receiving radiation, high dose zinc supplementation is not recommended because it's an antioxidant that may interfere with the treatment. So, this is something where um, if a patient is not receiving a treatment where zinc supplementation is contraindicated, it might be worth a try, but there isn't strong evidence in our population to suggest so. There isn't much risk of harm other than that zinc competes with copper for absorption. So taking zinc at doses higher than 40 milligrams daily for greater than 3 weeks could impact copper absorption. So this would be a shorter term intervention if someone wanted to give it a try. Um, with zinc, the recommended dietary allowance for women is 8 milligrams a day, and for men, I believe it's 11 milligrams a day. I'll have to double check that, but it's in that neighborhood. And most of the studies looking at zinc supplementation included supplements on the order of 50 milligrams daily. So we would consider that high dose. Another avenue could just be to increase high food sources of zinc, and that would be uh, most available in oysters, meat, and fish. To wrap up, I'll share a few tips and tricks for a typical day. This is a framework for a typical breakfast, but could really be applied to any meal. For someone who is experiencing lack of flavor, I would recommend trying to use the FAST acronym, that fat, acid, salt, sweet, when putting meals together. So at breakfast, that might look like a nice fluffy omelet with avocado as the fat source, diced tomato for acid, some cheddar cheese, but really any cheese would do to check that salt box, and then a side of fruit for the sweet. And before eating that meal, could be worth a try to slice a clove or lemon and smell it for 15 seconds to see if that doesn't help. If things are too salty, breakfast might look like a balanced meal, by which I mean ideally something that has whole grain, fruit or vegetable, and then a protein source with a naturally sweet food. So that could be fruit. In this example, oatmeal would be the whole grain with berries for the fruit, a side of Greek yogurt for protein, and then a drizzle of honey or a dash of vanilla extract. And again, it could be worth slicing the clove or lemon to smell before that meal. And then lastly, for someone having very metallic tastes, the baking soda salt rinse could be a good palate cleanser prior to the meal, followed by a homemade smoothie with frozen fruit, Greek yogurt or silken tofu for protein, and then a milk or a fruit juice of choice. And then ideally, that smoothie would be consumed from a glass cup or jar, something that won't add any extra metallic flavor. Lastly, mindset does matter, and we do encourage our patients to approach food as an integral component of treatment. Again, keeping in mind that it can be very challenging to push through taste changes. And for that reason, if there are a handful of anchor foods that are tolerable, that can be in the rotation frequently, identifying those is very useful. And that could be liquid nutrition, like a homemade smoothie from the metallic breakfast example, or an oral nutrition supplement such as Ensure, Boost, Kate Farms, Orgain. There are a lot of good products out there. And then lastly, trying to eat small, frequent meals at scheduled times can take the pressure off of any single eating event. And so that can be a useful strategy if taste is depressing appetite. We do encourage patients of the Mass General Brigham Cancer Institute to schedule an appointment with someone from our team by requesting a referral from their oncologist. And we see patients in Boston, Danvers, Newton Wellesley, Waltham, as well as virtually. Here are our references, and we can take any questions now.
Awesome. Thank you so much, Martha. That was really excellent. I wanted to just highlight, and you said it a couple times, and I think we can't stress it enough, is that taste is not something we adapted for our entertainment. It is something that our brain uses to protect us from food that is spoiled, from water that is infected with parasites, and it is really disorienting when taste is not what you expect, and your brain very rationally suggests for you to stop eating or to eat less when taste is altered. So all of those tips are incredibly helpful. I really like that FAST acronym, the fat, acid, salty, and sweet. The only thing I would add to that for everyone who's kind of using that to build their meal plans is temperature. That's the other thing that we can modify quickly, and often less temperature means less inciting, maybe unpleasant tastes. So, couple questions from the chat, and thank you all for asking them. If only a few foods taste normal, is that okay? Should I be worried about diet variety when I'm receiving treatment? And I wonder what you'd say to that, Martha.
And in the short term, if we're looking at, roughly a month or two of treatment, again, depending on what those foods are, it probably is fine. And there might be a few things we can work off of based on those anchor foods that might round out the diet. But generally in the short term, if something is working, we would encourage patients to just lean into those, enjoy them, and not worry too much, especially if they're able to maintain their weight.
Yeah, I totally agree. I think that healthy eating takes a lot of different shapes throughout our life, right? And certainly variety is important. We want to get nutrients from a diverse subset of foods, but at the same time, during treatment, our priority is really maintaining your weight, maintaining your strength. And if a few foods allow you to meet your calorie and protein needs without losing access to, losing body weight through your treatment course, it's totally fine to lean on those anchor foods through the duration of your treatment, and then expand the variety once you get away from treatment. And that's a nice segue to another question that I'll tackle first is, are taste changes that occur during treatment permanent? And can I expect that my taste will go back to normal after treatment? And I think that is always an individualized piece of the care process. So sometimes during cancer treatment, the taste changes are very transient. They're related directly to the medical treatment that you're getting, the chemotherapy or immunotherapy. The drugs that you receive alter the biological function of your taste buds. And as you get away from those drugs, we do anticipate that your taste will return close to normal, close to pre-treatment. And sometimes you can experience an improvement to your taste that occurs between treatment cycles. So right after treatment, maybe food doesn't taste the way you expect it to, but then the next week, it does taste the way you expect it to. Other forms of treatment may have longer lasting impacts on your taste, particularly radiation and surgery that induce structural damage to your tongue or to your taste buds. Those interventions may have longer lasting effects on your taste, and really it's a question with the surgeon or the radiation oncologist to determine like the prognosis for taste returning. Do you have any other perspective on that, Martha?
No, I think that was a great summary, Rob.
Awesome. And then the last question from the chat is, how should miracle berries be prepared for them to be the most helpful? I guess thinking about integrating that as kind of like an adjunct to some of the other tips.
Yeah, great question. I've only seen them available to purchase. They come in a little bag and they're dried, so you essentially would eat it alone before you start your meal and then give it about a minute, and that should be enough time to give you a window to eat. They, as far as I understand, last for anywhere from 15 to 20 minutes, and then the effect starts to wear off. And again, I would recommend trying to use them for things that you would expect to taste sweet, because they really do enhance sweet flavor. So I think having them with something like a protein food, like a meat, would not be appealing. It would probably be very strange. But if you're going to have, some fruit or like a protein shake that's a sweeter flavor, then they would probably help.
That's awesome. That's a nice tip because I haven't experienced them myself. Is it almost like a raisin or like a craisin?
A little bit drier than a raisin.
Okay.
I'm trying to think. It's almost like a cross between a raisin and an almond, if that makes sense. Like they're a little bit dry and crunchy. Or if you've had like a freeze-dried fruit, it's similar to that. But they really do taste very sweet. The lime juice that I had after it really tasted like a really sugary soda. At least that was my experience. So I think a few other cancer centers have been able to get samples of them for patients to try. But yeah, interesting kind of new option out there.
Awesome. Well, I mean, thank you again for the presentation. Taste is so biologically complex and influenced by so many things. So I think that this presentation offers people a really nice springboard to kind of navigate the symptoms.
Thank you so much, Martha and Rob. This was extremely helpful. I included the website to the Blum Center. So as I mentioned, this session is being recorded. It'll be made available on the Blum Center website. Just click on watch past webinars. And then I'm also going to enter in the chat, save the date for our next session, where we'll be talking about managing difficulty swallowing during cancer treatment. This will also be on Monday, January 12th at noon. And that website will direct you to the Blum Center website, which includes more information as well as the Zoom link to attend. All right, so before we wrap up, do you have any final thoughts you'd like to share with the audience?
I have nothing. I just want to say thank you all for attending. And our next presentation is after a lot of the major holidays. So happy holidays.
Happy holidays, everyone. See you in the new year. Take care.